So I'm a GI doctor and I recently made a video about how Docusate or Colace really hasn't been shown to improve constipation compared to a placebo. I usually take my patients off of it. But what do I use instead? Remember, this isn't medical advice, this is just education about constipation treatment and how I approach constipation. Treating constipation is an art, not a science, meaning there's not a set series of medicines you need to try first or second or third every time. Constipation treatments can be split up into categories. There's fiber bulking agents like Psyllium or Metamucil that help bulk up the stool by making it retain water and become softer. This is often a great option for patients who don't want to take a medicine because you can simply increase fiber intake in your diet. Then there are osmotic laxatives like magnesium, lactulose, and my favorite, Miralax or polyethylene glycol. These pull water into the intestine by osmosis to soften the stool and promote passage. Polyethylene glycol is often what I start my patients on because it can be used as needed, can be used multiple times a day if needed, and usually doesn't cause many side effects. The gut also doesn't start to depend on it like what occurs with stimulant laxatives sometimes. That's the next category. Senna and bisacodyl both stimulate the gut to contract to help push out the poop. And as a result, cramping and discomfort are a little bit more common with these medicines, which is why I personally often don't start with them. Often they can be used in tandem on an as-needed basis with another agent like Miralax. Using stimulant agents on a daily basis can sometimes make the gut more reliant on the medicine, meaning if you skip the medicine, you might be even more constipated. There aren't negative effects from this, it just means you might be a little bit more dependent on the medicine. Think of it like a blood pressure medicine you take every day. Most of the medicines in the categories I've already discussed are over-the-counter in some form, but a doctor can still help you determine a good regimen for you. If patients still have constipation after these medicines, then we can offer prescription medicines. Secretory agents like lubiprostone or amitiza stimulate the colon cells to release chloride into the gut, which in turn causes water to enter the gut and helps bowel movements. Fun fact, this is the same way that the infection cholera causes severe diarrhea. The medication Linzess does this as well, but it's indirect. We also have prokinetic agents like motegrity or prucalopride that stimulate acetylcholine release to actually make the colon contract more. There could be a variety of reasons why you would use one of these over the other, and sometimes we use multiple. That's the art of constipation management. I haven't discussed enemas or suppositories, but we can save that for another video. If you're having issues with constipation, please talk to your doctor because there's plenty of options available.